Hi, my name is Quyen. Welcome to my presentation on Is salt good or bad for your health? Salt. Salt has been used in food preservations and seasoning for thousands of years. Sodium is a central mineral your body needs. Sodium is involved in numerous cellular and organ functions. Sodium is important in regulating blood pressures and volume, helping transmit impulse for nerve function, muscle contraction, and regulating the pH balance of your body. Getting too little or too much sodium is not healthy. According to the WHO, salt consumption is linked to high blood pressure and cardiovascular death. WHO estimate if we are able to reduce salt intake to less than 5 grams per day or equal to 2 grams of sodium or about 1 teaspoon of salt per day, we can save around 2.5 million lives every year. However, this is a chart showing the estimated sodium excretion and risk of death or cardiovascular events. In 2014, a large study of more than 100,000 people in 17 countries in which sodium intake was estimated on the basis of measuring urinary excretion. People that were consuming 4 to 6 grams of sodium per day were shown to have the lowest risk of death and cardiovascular events than people with lower sodium intake. However, if you follow the WHO salt guideline or recommendation, the risk of death or cardiovascular event is much higher than people that were consuming 12 grams of sodium per day or 6 teaspoons of salt per day. Here is another example, comparing country daily sodium intake and their cardiovascular disease death rate. As you can see, South Korea and Japan, which had much higher sodium intake, had much lower cardiovascular disease death rate than the UK or the USA. Their sodium intake is more than twice the WHO recommended level. Low salt intake can be harmful. 1. It elevates LDL cholesterol and triglycerides. Salt restriction has been linked to elevated LDL or bad cholesterol and triglyceride. Heart disease. Less than 2 grams of sodium per day is linked to increased risk of dying from heart disease. Heart failure. One analysis found that restricting salt intake increased the risk of dying for people with heart failure. The effect was staggering, with a 160% higher risk of death in individuals who reduced their salt intake. Insulin resistant. Low salt diet may increase insulin resistance. Type 2 diabetes. Type 2 diabetes patient consuming less sodium was associated with increased risk of death. Here are some symptoms of low salt or hyponatremia. 1. Muscle cramp. 2. Muscle spasm. 3. Muscle weakness. 4. Getting dizzy when you stand up. Headaches and craving for salt. Here are symptoms of high salt or hypernatremia. 1. Swelling of the ankle, feet, and hand. 2. Puffiness under the eye. 3. Shortness of breath. And 4. High blood pressure. Here are general health benefits of salt. There are many general health benefits of salt. 1. Salt is essential mineral. Without it, you will die. Second, it is a vital electrolyte. Third, it helps balance body fluid. Fourth, it is essential for cardiovascular health. Fifth, it reduces risk of stroke. Sixth, it is essential for neural and brain functions and system. 7. It is needed for proper digestion. 8. Mood control, depression, and reduced stress hormone. There are many types of salt. The best types are sea and Himalayan salt. These are the unique benefits of sea and Himalayan salts. 1. Immune booster. 2. Improve sleep. 3. Prevent muscle cramp. 4. improve muscle tones and strength. 5th, improve bone strength. 6th, improve digestion. 7th, help with nutrient absorption. 8th, provide relief from asthma. 9th, clear sinus and the lung. 10th, regulate blood sugar level, which is beneficial for diabetes. What about salt intake and kidney diseases? The kidneys are very capable of regulating the sodium in a healthy person. But if you have damaged kidney, we need to help our kidney out by managing how much salt we consume. As your kidney function decline, your kidney ability to regulate sodium and fluid throughout your body will also decline. By giving our body the salt it needs, not too much, we can reduce excess workplace on your kidney. Higher salt intake on a low potassium diet, which is often recommended for kidney patients, has been shown to increase blood pressure. However, should you limit your salt intake, it will all depend on your lab results. You need to maintain the right amount of sodium. Your doctor will look at your lab, how active you are, salt craving you may have, and other life cycle factors to determine what amount of sodium is right for you, providing you a daily minimum and a maximum target. Thank you.